Hello, I am Dr. Lynn Kowalski. I'm a gynecologic oncologist practicing in Las Vegas, Nevada, and welcome to our first segment of Ask Dr. K TV. So today we're going to answer a question that many women ask me when they come to see me in my practice for a consultation. And we're going to have this sort of segment on a regular basis, so please feel free to email us with questions and I will try to get to your question as soon as I can. So today our question is, what is a hysterectomy? And I think part of the question is to talk about what a hysterectomy is, but also what a hysterectomy is not. Okay, so a hysterectomy literally means removing the uterus. It does not necessarily mean removing the ovaries and tubes, and it doesn't also necessarily mean removing the cervix. So there are different terms that we use to subdivide the types of hysterectomies. So for example, a total hysterectomy means removing the uterus and cervix. The total hysterectomy does actually not mean removing the ovaries and tubes. That's considered separate. So a lot of women don't necessarily understand the differences, and when they come to see me as a patient, they'll say, well, I had a partial hysterectomy. Partial hysterectomy isn't really a term that doctors necessarily relate to, because that would imply just taking out a part of the uterus and leaving another part of the uterus behind. We don't normally do that. So I think what a lot of women mean by partial hysterectomy is that the uterus and cervix were removed, but the ovaries were left behind. So let me show you a little bit on this model, and I think that'll help better explain what we're talking about. So this is a side view of a woman's body. Okay, so here's the bladder sitting on top of the vagina, cervix, and uterus. Here's the vagina here, and this is where we put the speculum in when we do a pelvic exam. And the rectum is down behind, okay? So the uterus here, this is actually showing half of the uterus, has the ovary and the fallopian tube coming off of the top. So they're connected, but just kind of by this thin area with some blood vessels in between, okay? And this side view is meant to show the canal, or what we call the endometrial canal. The important point here is the uterus and cervix can be removed separately from the ovary and tubes. The uterus and cervix's function in a woman's body is really just to carry a pregnancy. And that's the area that bleeds every month when a woman has a period. The ovaries are the part of the body that make the hormones and the part of the body that contain eggs. So if a woman needs a hysterectomy, for example, for abnormal bleeding from fibroids, she doesn't necessarily want her ovaries out at the same time because she'd like to keep her hormones. So if we do a hysterectomy and divide across this ligament here, we can leave the ovaries inside and the ovaries can continue to produce hormones. If a woman is past the age of menopause and the ovaries aren't working anymore, we typically want to take them out when we do the hysterectomy anyway. So thank you for watching Ask Dr. K TV. Again, I encourage you to send your questions to askdrktv@gmail.com. That's askdoctorktv@gmail.com, and I'll try to get to your questions in the future. See you next time.